Good evening, and welcome to the presentation of Living with Chronic Illness. As nurses, we have a duty to assist those in our care to be able to care for themselves and their health. Individuals living with chronic illnesses are especially in need of education and guidance due to their complicated health situations. The interdisciplinary team needs to work with the patient and their support people so that they can learn to manage their illnesses and attempt to use primary care and specialists as opposed to the emergency room and prevent hospitalizations. These admissions can be very costly, adding another burden to them as well as the insurance company. Many insurance companies have nurse navigators who help with patients who have conditions that need extra support. Our author discussed the importance of key stakeholders and health policy which dictate what access our patients have in healthcare services. My name is Colleen Wilkie and I'm a registered nurse in the Commonwealth of Pennsylvania. I currently live and work in the Philadelphia suburbs. I'm happily married and have two sons, Jose Dario and Brandon, ages 24 and 14 respectively. We are a Scout family. My husband and Jose Dario are Eagle Scouts, and Brandon is a Life Scout. I've worked predominantly in long-term care for the past 25 years. Prior to that, I worked in social services at Georgetown University Hospital after I graduated in the 90s. Currently, I work in a life plan continuing care retirement community as the clinical educator and the infection control nurse. I love my job. I so appreciate working with my new team members as well as our patients and residents and their families. I see patients daily with a multitude of chronic illnesses, and empowering them and their families to keep them out of the hospital is a very important part of my job. What is the illness experience? I'm going to define the difference between illness and disease, discuss the holistic needs of our patients, especially those with a chronic illness, and demonstrate the educational needs of patients living with these illnesses. Our author discusses the difference between illness and disease. Disease, quote, refers to the pathophysiology of a condition. Illness, in contrast, is the human experience of a disease and refers to how the disease is perceived, lived with, and responded to by individuals, their families, and healthcare professionals. Illness is the social meaning of the disease. As nurses, we need to remember the important mindful presence to listen to our patients and their families, to support them through the ups and downs of living with a chronic illness. There is no cure. There is only positive self-management to stay healthy. There are many needs for the patients, including physical, emotional, mental, spiritual, and financial. We need to be aware that the individual's needs are going to change over time, sometimes each day. We have to work with them to support them and put them in control of their conditions and their body. Our author discusses the importance of educating the patient and their family so that they do not need to let the illness consume their life. Social isolation. Social isolation is defined as social distancing. One best practice nursing for a child with hemophilia is pain control. I think the most important nursing intervention is education on the importance of physical activity to help control their chronic pain. Social isolation is the distancing of an individual psychologically and/or physically from their network of desired or needed relationships with other people. Specifically defined, social isolation is a state, quote, in which the individual lacks a sense of belonging. Society lacks engagement with others, has a minimal number of social contacts, and they are deficient in fulfilling and maintaining quality relationships. Hemophilia is an uncommon disorder that is difficult to diagnose and manage. While bleeding events in people with hemophilia is usually lifelong, they often occur in muscles and joints. I read an article that emphasized the importance of physical activity for children living with hemophilia. As a nurse, we need to teach the patient and their family the importance of exercise and reduction and control of pain. I read an article on the importance of recognizing the varying levels of pain in patients living with hemophilia. Children would probably benefit from the Wong Face Pain Indicator Scale as opposed to the traditional 0 to 10 pain scale. As a mother of a child living with a connective tissue disorder who experiences joint and muscle pain, I feel such a connection to the child in this case study and their family. I'm fortunate to live in the Philadelphia area with 3 children's hospitals. Not all families have this same access to specialists. What is health-related quality of life? Health-related quality of life is the measurable effect of chronic illness on an individual. Some of the best evidence-based practices are interventions to assist with these chronic illnesses. They are measurable. A nursing intervention for one of these patients would be detailed education on the process of a recovery from a stroke and what to expect, caregiver support and education for the family, teaching them about burnout and providing help with community resources is going to make the life better for the patient and the family. Our author discusses the difference between quality of life and health-related quality of life and emphasizes the importance of not using the terms interchangeably. Health-related quality of life looks at the individual in a holistic manner as someone who has many needs and how their chronic illness affects them and their daily life. Measurable evidence-based practices are the key to having a positive outcome for the patient and their family. There are many tools available for nurses and other members of the interdisciplinary team to measure the effectiveness of the interventions and treatment plan. Quote, managing chronic illness raises the nursing practice bar, challenging nurses to apply a caring, patient-focused, systemic outcome-based, cost-effective quality care model. The 60-year-old client with the recent stroke is such a tragic case. The family's life will be forever changed. Caregiver support is going to be the most important part of the care plan. The patient will have an interdisciplinary team with nurses, therapy, social services, a registered dietitian, and others. However, the caregiver will not have all of these supports. Most of the time, it falls on social services for finding community resources for the patient, and nursing is the predominant educator for the caregiver. Financial support is also going to be important for this family. If the patient was the family's primary breadwinner, they may not have the means to care for the patient in a safe manner. Does the patient have short-term disability? Do they have adequate health insurance? The added medical expenses from hospitalization, post-acute rehab, and home care eventually will have an impact on the entire family. The family is going to need education on what to expect from the stroke and how it will affect the patient. Physical limitations, the need for assistance with activities of daily living, such as dressing, toileting, eating, and bathing. There may be language and communication deficits as well as visual changes. The patient is also going to need emotional support as they will inevitably feel guilty for the added burden for their care needs on the family. Powerlessness. Powerlessness is a profound feeling that at its core can result in many emotions, ranging from anxiety, fear, and uncertainty to hopelessness. The best nursing practice intervention is empowerment and stress reduction education. This family and patient of the 20-year-old suffering with schizophrenia is going to need education on the importance of medication and compliance, counseling, and stress reduction. Schizophrenia is one of the most disabling mental illnesses, which is characterized by impairments in the cognitive, perceptual, and emotional realm. The onset of this illness usually takes place only in late adolescence or early adulthood. I truly believe that the most important nursing intervention and best practice is empowering the patient and their family. Mental health is such a neglected area of healthcare for a myriad of reasons, including negative social stigma, embarrassment, lack of mental health care services, and subpar health insurance coverage for the services. Patients often have to wait months to get an appointment and then hope that they have a good fit with their provider. Often, especially those on Medicaid, cannot find a provider that is taking their insurance due to the low reimbursement rate that they receive. This is so unfortunate, and as nurses, we need to ensure that the mental health needs of our patients, especially those with a chronic illness as serious as schizophrenia, are getting the support they so desperately need. We need to listen to them and let them know that we are there for them. We need to ensure that they are compliant with their medications, taking it daily, not just when they feel well. In summary, here are 5 takeaways for nurses caring for patients with a chronic illness. Education is crucial for a successful outcome. Empowering the patient and family should be a top priority for self-management of a chronic illness. Patients need to be the center of the interdisciplinary team when developing their plan of care. Preventive medicine is instrumental for maintaining positive health when dealing with a chronic illness. And finally, nurses have the professional duty and obligation to follow healthcare policy and be the advocates for effective use of the resources available to patients and their families. In conclusion, it is so important that as professional nurses we realize the crucial role that we play in our patients' lives. Without a comprehensive plan of care, the patient will not have a positive health journey. Education is the key part of the success or failure of the care plan. Patients and their families need to have the knowledge to prepare for a flare-up of their chronic illness and what steps they need to take to be in control of their health condition. Self-management is a top priority for the patient and their family. If they cannot manage the daily routine of medication compliance and treatments, the risk for emergency room visits and even hospitalizations increase. Keeping up with preventive medicine and regular checkups, labs, and diagnostic tests assists with the maintenance of good health. As nurses, we need to stay abreast of healthcare regulations and legislation that could potentially affect our patients, especially those with chronic illnesses. They have greater expenses, and without nurses advocating for them, insurance companies are able to dictate access to quality healthcare. This is not in the best interest of the patient and their families, and nurses have powerful voices and need to ensure that we speak up for and fight for their rights. Money should not be the basis of medical decisions, and the healthcare team needs to be in charge of what will be the best plan of care for the patient. The government has regulations called quality measures in place to assure that the care provided meets certain standards, and reimbursement is based on the score of the care. There are several measures and classifications that are used for rating quality care. Our author discusses how important structure with measurable outcomes is. Especially in a skilled nursing facility, this is crucial for our payment, and nursing documentation is a large portion of the process. Insurance companies and Medicare and Medicaid can cancel payment if they do not have all of the information they need for reimbursement. Nurses are such an important part of the healthcare journey for our patients living with chronic illness, and we need to make sure we are doing all that we can for them and their families. I thank you for your time.